Tell me when to start.
You're good.
Hi, I'm from St. Louis, Missouri, and I left for the island a week ago today. And when I left, I was already in back pain, but knew I needed to push forward for my family so that they could have a good time, thinking that I would be okay. I had hip and back pain. I knew my pelvic was off. I'd been to other chiropractic care Wednesday before I'd left on Friday. And that's when I felt the hip was a little more off than it should have been. By the time it was Memorial Weekend, I knew I had Saturday, Sunday, and Monday to get through before I could get any help. By the time Tuesday came around, I thought I was going to need to go. One of my family to take me to the hospital. I was in such pain. I called from chiropractic on Tuesday morning, got an appointment at 2. By the time I got in here, fortunately, I got Dr. Morris. I was in tears, and his entire bedside manner gave me this feeling of hope, and that he said by the time I left on Tuesday, I was going to feel better. Wednesday, I had started to turn the corner, and he saw me every day, Tuesday through Friday, and this man is an absolute gem. If you need chiropractic care and you want great service and support, you've got to come see Dr. Morris. And the blessing is he was from St. Louis, so he could give me a referral back to St. Louis, and it's definitely a God situation. So I thank Dr. Morris for restoring my life in the last 4 days. Thank you.
Hello, Kim Tombragel here. I started having back issues in 2000, had back surgery in the lumbar region, went through the whole protocol, PT, massage, was good for a number of years, and then started having issues again about 14 years later. Repeated the protocol, this time using a pain management specialist who provided, relief, but it wasn't long-term given my particular medical musculoskeletal issue with my pelvis way out of alignment and the spine following. So they gave me a referral to Dr. Brad Morris here at From Chiropractic Life Center. Utilizing the existing medical information I brought over and doing your own evaluation, Brad was able to determine that given the pelvic rotation and the spine twist that follows it, both lumbar and upper, it would take some time to get that back into alignment and provide long-term relief to me. The pain management helped, but given the severity of the movement of my skeleton based on some early childhood medical history and surgical interventions, it was necessary in order to get me back to a point of balance and less strain on the nerves out of the lumbar region. So with back decompression and other manipulations, I am seeing, marked improvement. It's not going to happen overnight given my, decades of development of the situation. But I'm optimistic about having now a chiropractor, Brad specifically, is a functional medicine doctor in addition to chiropractic, working with my pain management team to have a care team that's looking at me holistically and collaborating together because that's what I need for my long-term personal and professional performance and wellness. So, and quite frankly, that's where the government and CMS is going anyway. So I think these guys are ahead of the curve. Thanks.
My name is Becky. I came to Hilton Head for a 12-day vacation. On day 1, I had 2 severe lumbar herniations. I was unable to stand up. I was flat on my back, but I found From Chiropractic and I got in touch with Dr. Morris, and he started doing spinal decompression, and by day 2 I was able to stand. It was incredibly helpful. We did the electric stimulation. I was in here just about every day for the first 3 or 4 days, and then we started spreading it apart. And this is day 10, and I am fully walking. I'm able to do all the activities I could not do before. So I'm a very firm believer now in spinal decompression.
I pretty much trashed my neck and my back through 22 years of Army Special Forces and jumping out of airplanes. And I have degenerative disc disease, protruding and bulging disc, and spinal stenosis. I've seen all kinds of doctors and neurosurgeons, and they all gave me no hope. I've done all the treatments, the injections in the back, massage therapy, physical therapy, even done acupuncture. Nothing gave me any relief, so I've been on narcotic pain medicine for 7 years now. My dose consisted of 40 milligrams of OxyContin 3 times a day, supplemented with 10 milligrams of Percocet twice a day. Been on that for years. And once again, the doctor said that there was just no hope I was going to slowly deteriorate, and then eventually they had to do surgery on my back. Then I discovered this spinal decompression therapy and decided to give it a try. After just 6 sessions, I didn't need to take my Percocet anymore, and noticed that in the mornings when I woke up, instead of reaching for my pain medicine first thing and having to sit around for 45 minutes to an hour waiting for it to take effect, that I felt great and I could get up and do whatever I wanted to in the morning. The only reason I took the pain medicine is because my body was physically addicted and I had to take it. And so after 12 sessions, we started to talk to my pain management doctor, and they've been weaning me off since then. Completely eliminated Percocet from my regimen, and now have my OxyContin at half the level that I was taking. And at 2-week intervals now, we're going to be breaking it down, and I'm optimistic I'll be able to come off the pain medicine completely. So I'm really happy with the treatment I've got here. Dr. Morris has done a great job with me. With all the years of experience he has in this, I'm sure that's been a big help in getting this done. And all of the doctors I've talked to, my pain management doctors, my primary care, the VA doctor, have never heard of spinal decompression, but now they're all very interested in it, and they're asking me to bring me Dr. Morris's business card and literature on this because they want to start referring patients down here too. So I'm really happy with everything so far, and it's definitely worth every penny of the treatment.
Since I started the brain-based therapy, I've noticed that the pain in my leg is less, and that when I sit down I can cross my left leg over my right leg, which I haven't been able to do for a long time, and I can hold it there now, even for probably 2 or 3 minutes where I couldn't before. And I think I can think clearer and for a longer time.
Go.
Hi, my name is George Russell, and I have been a patient of Dr. Morris since January, and I came in weighing about 180 pounds and with a lot of back pain and a lot of neuropathy. I was falling down and having a hard time with my balance. He has corrected the balance. I have much better feeling in my back now, and I am stable. I lost about 15 pounds, and right now I feel great. The nutritional elements that he gave me were also very, very effective in treating the neuropathy and my back. So I'm very appreciative. He's done a great job for me. Thank you.